So hello and welcome to an update on our response to the COVID-19 from Springs Medical Centre, but also from Central Highlands Rural Health. And we're really lucky today to have along to what is a Zoom meeting to Dr. Sophie Ping, who's the Director of Medical Services at Central Highlands Rural Health. Hello, Sophie.
Hello, Jared. Thank you so much for the opportunity to chat with you. And I think this is a great way for us to get information out to our community. So thanks for organising it.
My pleasure. One of the reasons we wanted to bring you on particularly is that there's some exciting new changes. You know, for quite a period of time, we've been saying, oh, well, testing, if you want to get tested, we're doing a little bit of testing at our clinic, but most of the testing you need to go to Ballarat or Kyneton. But that's changed in the last week because we now have a testing clinic and actually an assessment clinic as well in Daylesford at the Community Health Centre. Can you tell us a bit about that?
Absolutely. So this is really exciting for Central Highlands Rural Health to have the respiratory assessment clinic, and I would actually like to take the opportunity to give a huge shout out to all of you, the doctors at Springs, because it's a joint effort. This isn't something that we can do by ourselves. And I've said before, lots of positive things have come out of COVID and the collaboration has been amazing. So thank you to you guys for that too. So the doctors are a huge part of our respiratory assessment clinic. It's set up in our community health centre, the first two rooms, or the two rooms at the front of the building there. I suppose we should start off with what the phone number actually is. So if you've best number to ring the respiratory clinic on is 5321 6654, and that is up on everybody's websites, I believe, or if it's not, we'll make sure that it is up there. The respiratory assessment clinic isn't replacing the GP clinic. It's not replacing urgent care. If you're not sure about whether you're too sick or not sick enough to go to the respiratory assessment clinic, please still ring and check. So if you're feeling incredibly unwell, obviously if you're incredibly unwell, first thing you do is call an ambulance. If you need some assistance and you're not sure, you can call our urgent care centre or drop in as well. And all of our nurses and our doctors are online as well for us to be able to check what's the most appropriate way for you to be cared for and tested. So if we're really concerned that you're incredibly unwell, we might not have you at the respiratory assessment clinic. We might send you to urgent care centre or the Ballarat emergency department. It depends on how sick you are. If you're feeling a bit unwell, but you're still walking and talking and speaking in full sentences, please book in at the respiratory assessment clinic, again on 5321 6654. We've got a triage process in place there. All of our fabulous registered nurses who are staffing the clinic will ask you a series of questions about symptoms that you've got, whether you're unwell, whether you've had contact with people who are known to be unwell, whether you're associated or have contact with people who've been in a cluster, such as Cedar Meats or the McDonald's or anything like that. So that tells us whether you have been requested by the department to be tested, and that will again mean that we can test you even if you don't have symptoms. If when we ask you those questions, we think that you're a little bit more unwell than we would like, we will ring one of the doctors, Jared, or anyone who's on call from Springs Medical Centre, have a discussion with them about what we think the best way to look after you is. Whether or not you need to be seen urgently, whether you need to go to urgent care, or whether we book you into an appointment at the clinic that is later in the day. So what we actually do is effectively cohort you with other people that are also a little bit unwell but need to see the doctors. That's to keep our doctors safe as well, and we keep the Springs Medical Clinic as a clean site so that we're trying to reduce the possibility of having any COVID infections where a lot of people are going to go. So we've got all sorts of cleaning processes in place for the respiratory assessment clinic. You're not being discriminated against in any way by being asked to come to a different appointment. It's so that we can, because the doctors are assisting us with this, and it's a big impost on their time as well. We try to put everybody that needs an assessment by one of our doctors to be in a group of appointments so that saves time for the doctors as well.
So Sophie, just to clarify then, this is an appointment-only clinic. You have to ring to make an appointment to come in. And as when you ring to make that appointment, some what we call triaging, sorting out who needs to go into emergency or urgent care and who can come into the clinic, and even of those who come into the clinic, who would need to come into the clinic but also be seen by a GP. That's what's
Absolutely.
going on. When they actually come in, you mentioned it's all been cleaned and sorted out.
Yep.
So what happens? What sort of testing happens?
So again, to keep people safe, we ask you to wait in the car until we tell you that the room is clean and that there aren't other people. So we're trying to keep social distancing in place. We will ask you some more questions when you come in. So because we are making appointments, if you've called at 9 a.m. and then you're not coming in for an appointment until, say, 2 in the afternoon, we do ask you additional questions again because you may have become a little bit more ill or developed a cough or some symptoms since that time. So there are a lot of questions that we ask you. You'll have your temperature taken, your oxygen saturation, so some basic observations in addition to those questions. And basically what happens is that we're working out how high a level risk you are to have developed a COVID-19 infection. So we've got these swabs, they look like giant cotton buds, and basically what we do is open, this is not very attractive on video, is it, Jared? Sorry.
No.
But it's down the very back of your throat, and we take a little swab from across there. And then the other thing that we do is stick it up one of your nostrils, not very far back, and we can't go too far back anyway. So we do what's called an oropharyngeal swab. That's at the back of the throat. And we do a nasal swab, a deep nasal swab. So that's from your nostrils as far back as we can go without causing you too much pain. Because the swabs are a little bit bigger, and we don't want you to feel really unwell or that we're tickling your brain with that swab. But so those are the places we're most likely to get the virus sample from.
I think with the previous swabs, or people were seeing these ones which are going way deep back in the nose, which are pretty uncomfortable for people. We're not doing that now, so I'm sure people are very happy to know that it's just a tickle of the tonsils and then a little one up your nostril, but not too far back in your nostril.
Yeah, yeah. So lots of people have a really sensitive gag reflex, but it's like actually if you brush your teeth a little bit too far back, it's just going to feel like that.
Okay, and then people will get the results.
Yep. So we send off the results. There's sometimes a delay in the results because a lot of people are being tested. So the fact that you haven't heard from us doesn't mean that something's gone wrong with your sample. There's a lot of news coming out every day about the delays and why they're delayed. So depending on how many people are tested, your result can come back from anywhere between about 24 hours to hopefully not, but sometimes 5 days. So the thing that we're doing is all of the results do come back to us at Central Highlands Rural Health at the clinic. But what we can do is get those results copied over to your usual GP if you would like them to have a copy of that as well. And we will contact you. We've been using an SMS system. So we'll ask you for the best contact detail for you and make sure that that's your phone number that will be SMSing you to tell you what your result is.
Because Sophie, we are really we want to test everyone who's got symptoms. We're not currently testing people who are asymptomatic or without any symptoms. So just, I want to know whether I've got COVID-19 at the moment. But we are testing people with symptoms. So anyone even with a mild cough or cold or fever, we are looking to test all people with those symptoms. But if a person is a bit sicker, and particularly those people who already have some asthma or emphysema or bronchitis, they're more likely to be sicker. And if they're not so sick that they need to go into urgent care, they may often still need to be seen by a doctor. And as you said, they're going to be grouped together and they will be seen. One of the GPs from Springs, usually the on-call doctor for the day, will come across and conduct an assessment. So not only will you get testing, which will happen at the Respiratory Assessment Clinic, but you'll get an assessment by a doctor and a management plan for how you would go and what follow-up would happen after that.
Absolutely, and we can provide advice about isolating and that sort of thing as well. So, and it's actually an interesting point that you bring up with the runny nose and the cough, and those are actually symptoms of winter anyway, which is a little bit tricky. And there has been a lot of conversation around the idea that Australia would get a peak in COVID cases at the same time as the flu vax. So I know that's something that Springs has been really working very, very hard on to help the community out with. Would you like to Tell us how you're going with the flu vax.
Yeah, well, we've had great problems with supply, but we have managed to work through. We've been doing clinics on a Sunday. We've been getting up to 200 people a day. I think we've now done over 2,000 influenza immunisations, and we are now taking, if a person needs a flu vaccine, now we're no longer needing to run special clinics to get through the numbers. You can just ring up and make an appointment. So that's going on. Sophie, we were going to talk about hospital visiting and
Of course.
other times, but these YouTube videos, I don't like them to be too long. So,
And I talk too much.
you're just getting the information out there. You're just getting the information out there, Sophie. So, look, and we know that with hospital visiting, the rules keep changing and as we're opening up. And so I think the best thing is that people, they want to know whether they can visit the hospital to see a patient in the acute section or visiting people in aged care. The best is just to be ringing, to be checking.
Absolutely, yeah.
The rules are likely to change as things develop. We are aware that, as the society is opening up and things are coming back, there will be more respiratory illness, there will be more testing. At the moment, we haven't had many people coming through the respiratory assessment clinic, but I expect the numbers will be going up and up.
Yeah. So it's open from 9 till 5 each day. If we don't have a lot of 9 till 5 on Monday to Friday. And if we don't have a lot of appointments, we'll try and fill up the morning appointments first. And again, as things change and with society opening up again on Monday, I'm expecting a little bit more respiratory symptoms about out there. But please, as we said, just give us a call on the number and we'll book you in and do our very best to take care of you and our community.
It's great, Sophie. It's really wonderful that we've managed to get this assessment clinic up and running in Daylesford.
Pretty record time, and there's been a lot of people involved in making this happen. So thank you to all of them. Again, thank you to the doctors. I don't want to name names specifically because I will inevitably miss somebody, and that would be hideous.
Those people, we've been having, weekly meetings between the Springs Medical and the Central Highlands Rural Health Service, and also Hepburn House and the
Shire, and it's been amazing to work with everybody together.
There's some things which we've taken from this, which hopefully we can take forward into what we call the new normal.
The COVID universe.
Okay, thanks very much, Sophie,
Thanks
for that update.
Thanks so much, Jared. Lovely to speak to you. Thanks, everybody.
Bye-bye now.
Bye.
Bye.